Being a nurse in hospice care is the best job I've ever had. It's a very rewarding job. For me, it's a privilege to be a part of these patients' lives at this time. They're very vulnerable, and so to be allowed to be part of that, for me, is a huge privilege. I like to be able to talk to my patients, to explore who they are as a person, not just seeing their disease or their illness, but seeing who they are, finding out what's important to them, what matters to them. I can find out about what their wishes are. Their time is very short, so what is important to them and how can we make sure that happens. And that can be anything from alleviating a symptom to spending some time outside in the fresh air. And that's a big thing for me, is finding out what's important to the person, what can we do to ensure that we support that for them. Previous to working at St Luke's, I was a maternity support worker. I'd done that for many years. I then had a break and then I did my nurse training in the adult nursing world. The staff are so caring, the staff are all here for the patients. That's something I've not found on any of my other placements, any of the other places I've worked in. Everybody was there purely for the patients. My role at the hospice as sister on the inpatient unit, my day will start with handover from the night nurses to find out how the patients have been overnight. I'll then work out a plan for the day based on patients' care. I'm looking after the team, so that will be involving delegation, making sure that they're all happy with the duties that they've got for the day and that they feel well supported. I also liaise with the doctors, so I will hand over to the doctors as well, so it's multidisciplinary. Some days we have meetings to discuss patients and their whole holistic needs and what we can do to help them and support them further in their care. Then it will be medication rounds with the patients, talking to them, and the day usually runs itself. It depends on what the patient's needs and wishes are. It might be there's some admissions coming in, it might be that there's some discharges. The day really depends on the patients. It's very much led by them and what their needs are. From doing a medication round, you may pick up on a cue that a patient is worried about something, so I'll make a mental note to go back when I have time to fully explore that and discuss that with them.